Welcome to the Low Carb USA podcast, where we seek to inspire you to help us build this community. I'm Doug Reynolds.
And this is Pam Devine.
Okay, so I've got Andrew Oswari here with me. He's a family medicine doctor who's practicing integrative medicine now, correct?
Yes.
Welcome, Andrew. He's just become one of the very first physicians and practitioners to become accredited with the Society of Metabolic Health Practitioners, the SMHP. And part of his application for the accreditation was like a justification essay that he wrote about why he's in this field in the first place, and maybe went over a couple of his successful and difficult cases in that. And it was really inspiring for me to read that. Kind of made me kind of justified my being around, like that, you know, what we were doing and providing for physicians and other practitioners was really useful. So Andrew, I think just to start with, maybe just tell us or explain to us why it is, or how it is that you came upon this lifestyle medicine concept and why you've felt you needed to adopt it in your practice. Let's start there.
Sure. First of all, it's a pleasure and an honor to be here with you. I hold you and Pam in high regard because you've actually helped reshape the way I practice. And it started off actually 2 years ago. In fact, tomorrow will be my 2-year anniversary of being low carb. Back in January of 2019, I had a hemoglobin A1C of 7.4. And I was devastated, to be honest, because I had taught medical students who rotated through our department about diabetes. And I had no idea, there was no way I could be diabetic because I was doing all the right things. I thought I was exercising 4 or 5 times a week. I was mostly vegetarian, honestly. I'm actually Seventh-day Adventist, so I went to school at Loma Linda, and actually I preached that vegetarian diets were actually the way to do it. You know, I had read Neil Barnard's book about diabetes and all that stuff. And anyway, so 2019, I found out I was diabetic. Again, I was devastated. And as I was going through my practice, there was a patient, Diane, who kept coming in every week. Part of the things that we do is to do trigger point injections and to help neck pain and back pain. And she would come in monthly for this treatment. And I was noticing for the last couple of months that she was thinning out. And I was like, how are you doing it? And she would say keto. I said, okay. And then I would move along. But this time in February, when she said keto, I said, man, I got to do something. Because I had done everything. I had done Weight Watchers. I did the HCG diet. I did the Zone diet. I did all these things that were supposed to help me, and it failed me. And so I joined a Facebook group because I didn't know where to go to. I set my macros. And then 2 weeks into it, I realized I felt great. I realized I had headaches every day. And I thought it was just the stress of the job. I was so irritable at work. I was looking forward to retiring. I wanted to find a way out, but I was stuck. I had irritable bowel syndrome that I thought I would have for the rest of my life. All these things disappeared. I had gone low carb just to lose weight, to hopefully cure my diabetes, and all these things happened. I picked up Josh Axe's book actually on keto diet. I was reading about his mom who had cancer. And when I was reading through this, I immediately looked up one of my patient's numbers. I texted him. I said, listen, you got to do this. I took snapshots of the book to send to him. And I have never looked back. That same week, I looked up online to see what training there was. And I found you guys. I found Low Carb USA. And you directed me towards Nutrition Network. I've taken all of their classes. I took them way in the beginning, and here I am. And I can't stop talking about it.
Well, because that was like, you know, we in order to be accredited with the SMHP, you need to do not all, but a certain number of core modules from the nutrition network. That's one of the pathways. And you sent me your certificates, and like you'd done all of them.
I did.
So it was quite impressive. You definitely qualified like immediately, you know. Talking about that, and I don't know how many people listening to this will already be familiar. I'm hoping a lot of them will be, but maybe some aren't. So the Society of Metabolic Health Practitioners, we put in place as a real nonprofit organization to form like an umbrella organization for practitioners to be a part of, to give them kind of some credibility, to give them some support if they feel that they can't, or they're afraid to practice these interventions in, you know, because it's not standard of care or whatever. And eventually with the publication of the dietary guideline, the clinical guidelines, and then the conversations that come around that we would establish standard of care. Adele Height had a lot to do with that, and you know, a great board of directors that we put together. But we built it and kind of released it, and we weren't really sure. I thought it was a good thing, but I didn't know how it was going to be, you know, perceived and accepted in the community. And the minute we let it out, like a bunch of people joined. We had hundreds of people like adding their names at least in as practitioners in the practitioner list that's like kind of open to this conversation. And people started applying for accreditation, and you were one of the first. So I'm just interested to hear from you, well, hopefully so that other people can hear what you think or how, is the value in this for you, and then the second part of the question is the organization itself, and how you see that down the road, and how you feel like we might grow.
You know, first of all, as a physician, I had to go to Facebook to find out about low carb. I literally just joined a group because I didn't know where else to go. And I don't think that's the right way for anybody, especially a physician, to look for ways of actually taking people off medications. I did read the guidelines that you put out when it was still Low Carb USA, and I read them very quickly, and because I needed to know for myself, how do I take my patients off medication safely? Now that there's a place, it's an easy find to look for. We can find the guidelines, you can print them out very quickly, and patients can actually take these guidelines and give them to their doctors. But I was so excited when you guys set this up, because when you look at every change that happens, it has to come with a united front. Otherwise, things get taken out of context so easily, and things get battered so easily, that we have to have a united front like this. And the group that you've put together is just outstanding.
Yeah, well, I hoped it would be. I hope people would feel that it was. I thought it was, but as I said, it's all the proof's in the pudding, right? Like when you actually put it out there and you see how people respond, then you know, okay, maybe we're doing the right thing. And I feel like we are getting that response.
You know, when I started my journey, Low Carb MD, your podcast, you guys showed me folks like the Fetkes and Tim Noakes, these folks who were persecuted because they were actually healing their patients, which blows my mind. Mm-hmm. And because of those type of testimonies, I'm brave enough to easily push this forward. But when you have a society behind you as well, it makes it a lot easier.
Yeah, actually, talking about the persecution, I literally yesterday just updated the description of I cut like a little short 4-minute video out of a talk from a couple of years ago, from one of our events in San Diego, where Dr. Dwight Lundell was speaking. And he's a cardiothoracic surgeon, and having the same sort of experience as you, is like saying, like, I'm not fixing anything. Like, people, why don't we go upstream and try and prevent this from happening, or solve it without doing these operations and these other medical and surgical and pharmaceutical interventions. And so he started doing it. Eventually, he retired, and he started a weight loss clinic and a like a keto clinic, basically, to try and get patients to solve their cardiothoracic or their cardiovascular conditions with the lifestyle interventions, and also coaching people, hoping that they won't develop those things in the first place. And he was struck off. So they basically found, and he said, look, in a lifetime of practice, there's going to be a couple of times where something went wrong, right? And he said, if you investigate it hard enough, you can always point a finger at someone. And he said, sure, I made some mistakes in those cases, but they were genuine mistakes, and we learned from that and we moved on. But they went back 15, 20 years to one of these cases and used that as the reason for taking his medical license away.
Wow.
And he said, like, on the one hand, I wasn't practicing anymore, so do I care? But on the other hand, it's my reputation, and so I do care. It hurt me deeply. And he said, basically, that he tried to look at it basically almost like as a badge of honor, that if these guys came after him, then maybe he was doing something right. He said, I'm no Tim Noakes or Gary Fettke, but I feel like, I can wear this as a badge of honor. And it was Dave Feltman actually came up to the mic during the Q&A, and he said, I'd just like to confirm with you that we here as this community see that as a badge of honor. And literally the whole crowd stood up. They gave him a standing ovation. Then he was just saying, he was embarrassed, like, please sit down. But it's the same thing. Like, there are people that I didn't know that this has happened until he said it on the stage, And so it's not just Gary and Tim. There are so many people that have been persecuted. But now I feel like we have this umbrella which gives people protection, where they can say it is becoming standard of care. And I know it's supposed to be you talking and not me so much, but I interviewed Adam Pike a while back for the podcast, and he was one of the lawyers that was on Tim's trial.
Yeah.
And he brought up something really interesting to me, that he said that there's this concept of patient autonomy, and that especially if there's science you can show that backs up your decision, and then you make the patient aware of all the options and they choose, then it doesn't matter if it's not the currently considered standard of care. You are actually within your rights to work with that patient with that with that intervention. And I feel I was amazed. I thought, I'm sure there's a lot of doctors maybe don't even know about that. They don't realize that that if they do this, that they are protected as long as they go about it the right way. So even without the standard of care that we hope to establish, they still can do it as long as they follow the right procedures.
Yeah, I mean, I believe that doctors have their patients' well-being in mind.
Yeah.
But I also believe that the current environment of practice is more to cover your butt than to do anything out of the normal realm. I was doing some research regarding the American Diabetes Association, and first of all, it took them 80 years to get Tracy Brown to be the first diabetic to be the CEO of the ADA, who actually found low carb and actually got herself off of insulin as well.
Mm-hmm.
But one of the things that was interesting was there was a 300 of the type 1 grit, they named themselves. And there was a study done on these guys that they're type 1 diabetics on a very low carb diet, hemoglobin A1C of 5.6 on average. But what really struck me was this part. It said participants reported high levels of overall health and satisfaction with diabetes management, but not with their professional diabetes care. And 27% did not even discuss their adherence to a very low carb diet with their diabetes care providers. Of those who did discuss their diet, only 49% agreed or strongly agreed that their diabetes care providers were supportive. Narrative explanations by participants for not discussing their diet included disagreement on treatment goals and approach, perceived provider disinterest or unfamiliarity with VLCD, a desire to avoid conflicts with the provider, and for parents, a fear of being accused of child abuse.
Wow.
I mean, I have patients, I have friends who are low carb and won't even tell their doctor because they're afraid of the backlash that they're going to get. And that has to stop. It's so discouraging for them and for us.
It is, and it's actually criminal. I feel.
I agree.
Gary Fetke talks about it quite frequently as well. Is that there is a class action lawsuit down the road in this. That especially for physicians, where they have the Hippocratic Oath, and their obligation is to first do no harm. And to move with the times, if they learn that something that they were doing, I mean, fair enough, that was standard of care, but then they learn down the road, and that's happened through medicine through the years, right?
Yes.
You have an intervention, and then after a while, you're like, hey, wait, that wasn't such a good idea, and this is a better way to do it. And doctors, I feel, are obliged to keep up with the science. And once they are exposed to that information and then they refuse to acknowledge it and at least offer it as an option to their patients, I feel it's bordering on malpractice.
It's very difficult, though. I mean, the current environment is seeing patients every 7 to 10 to 15 minutes. And when someone does come in with a stack full of papers saying, look at my research that I've done, that's the last thing you want to do is go home and read through all these papers.
Right.
Especially with this COVID stuff. I mean, I don't know how many patients have sent me YouTube videos, clips about this and that, about conspiracy theories and all this other stuff. And I had to find this on my own. I had to find it and experience. In fact, I had a patient who 10 years ago told me about keto. Mm-hmm. Because she has a brain tumor, and she saw Dr. Perlmutter, and he told her to go on a keto diet, and I didn't look into it any further. Right. So I just believe that when we have a society like this, who can push the narrative a little faster, that we'll be able to do a ground up movement, just like the ADA. I mean, that was a paper. 300 youth doing a very low carb diet. We have Tracy Brown, who just becomes the CEO. And then in 2019, they finally say, low carb could be an option.
Could be a valid intervention to try, right? So right. Something to that effect.
But it started from not them. It started from other people outside.
So yeah, I mean, and I think that's the hope that with the dietary guidelines having such an influence on everything, but I still don't hold out. We have to keep fighting. We can't let the other side just run rampant over it. So we have to keep fighting that. But whether I don't personally feel like we're really going to make any inroads and get any changes done in the near future, in 10, 20 years. Mm-hmm. So in the meantime, the way to do it is to Adele talks about that. We want to basically make the dietary guidelines obsolete, basically. So we start from the grassroots, as we're doing here, yes. And we build that up until it becomes the accepted norm. And then the dietary guidelines can either go away or change, because nobody will be taking any notice of them anymore. And that's my hope, that down the road, that's where we'll go.
You know, I saw a panel discussion with Dr. Lustig in one of the Nutrition Network, and he was talking that it takes about 30 years for something to change. And he brought up smoking cigarettes.
Mm.
Like getting cigarettes out of the restaurants. It took 30 years. It took more than 30 years, actually. And then the seatbelts, wearing seatbelts in a car. It took 30 years.
Well, yeah.
He says we're about 8 years into this. So
yeah, so in order to get that changed, 30 years, but I feel like we can still make massive inroads with a grassroots organization like we've started.
Absolutely.
You know, if everybody gets on board and says, I don't care what those things say, this is the truth, and we're going to go with that. So, okay.
Exactly.
That's cool.
If we can bring the news to other physicians, if we can bring the news to parents, I mean, even if it's not physicians, bring it to the patients, bring it to the parents, let them know, let them experience it themselves. It's got to change. It has to change.
It has to. I agree.
Yep.
So I think a cool way to kind of finish this off was, I mentioned in the beginning that you wrote an essay, like a justification essay, when you put in your accreditation application, and I think I wrote something back to you saying it literally brought me to tears because of how powerful it was, and making me realize, you know, how valuable this is to so many people. If you're okay with it, I will publish a link to it, you know, in the show notes, only if you're okay with it.
Sure.
But it just for now, if you wouldn't mind, maybe just summarizing those 3 cases that you talked about in there, and helping people understand how awesome, you know, what you're doing is.
So the first one, when I said 2 weeks into low carb, my whole body changed, and I had to share it with my patient who had cancer. He actually shared with me that it had spread, and he was keeping it quiet, and he was getting burned out with what he was doing as far as his diet and everything, and it gave him a new lease on life, and he's thriving. Couple of the biggest things for me, though, is the ripple effect of low carb. I had a patient who wanted to get off diabetic medication, so she reached out to me, and her husband decided to do it just to help her out. And during our interviews or teaching classes, my wife and I, turns out that he was on 5 different hypertensive medications. And during the course of this, within 3 or 4 weeks, I had to tell him, well, I think you better stop one or two, this medicine. And then the next week was another medicine. And so again, a ripple effect. And the other ripple effect was another patient of mine who came in, not even for weight loss. She was exhausted. And just going through her history, I knew that her metabolism was absolutely wrecked. So we fixed that. Again, her husband decided to join in to support her. And then she texts me that when he went to the cardiologist, his numbers were so good that he said, the cardiologist told him, just keep doing what you're doing, and he cut all the medicines in half.
Wow.
Her sister, who has had rheumatoid arthritis for, I think it was over 40 years, and prednisone on and off for the last 20 years, is off medicines because she was able to sit in on one of our Zoom meetings with her. I mean, that's the stuff that just drives me personally as a physician, as a friend, because these folks they've actually become my friends. I learn from them as much as they learn from me. And it's just brought a brand new passion to my work now.
Yeah. Dr. David Unwin, who from the UK, who spoke at our last event, he talks about that as well. I mean, it was literally one of his patients that converted him, right? But and I didn't realize that I'd been telling that story sort of secondhand until I interviewed him. And he tells me that because she was in the waiting room, he'd asked her to come in because she hadn't been filling her prescriptions and stuff. And he said to her, like, you must be early because I'm waiting for someone else. And she said, nah, it's me, you know. He didn't recognize her. She had changed so much. But what I didn't know was that she actually yelled at him. She was actually angry. And she gave him hell for not knowing and telling her that she needed to cut out not just sugar, but all carbohydrates, which just turn into sugar in my bloodstream as well. She worked that out for herself and another Facebook group as well.
Wow.
And I said to him, yeah, well, you know, on the other hand, though, you know, your doctors don't get taught that stuff at at college. And he said to me, that's no excuse. He said, I was a doctor. I should have known better. I should have seen that stuff wasn't working, and I should have gone and tried to find out why. And he took the responsibility on himself to say it was actually my fault. I agree with her that she was angry. She had the right to be angry, and I'm going to change this. That was just such a powerful story for me as well. So
absolutely.
I
must have stopped teaching about nutrition probably 3 years before I changed, because I knew it wasn't working for me. So how could I teach it to anybody else?
Right.
So I just stopped.
Brian Lenskes was the same. You know, I mean, he started trying it on himself because he was desperate. He was doing like you. He said he was following all his guide, the advice that he's giving his patients, and he's putting on weight and getting pre-diabetic and all this stuff. And it's like, you know, I got to try something. So he tried it on the sly and the quiet, you know, like a lot of us do, and we do not tell anybody about it.
Exactly.
We're just going to do it quietly and see what happens, you know.
Yeah.
But even though he saw the changes in himself, he still didn't want to go to his patients with it because he was afraid it wasn't standard of care.
Right.
And then he came to our event in 2017 and heard all of these, you know, really fantastic speakers and that, and thought, okay, this is legit now. This is not just something that I read on the internet and tried. You know, this is for real. Absolutely. And he had the confidence then to go back on the next Monday and start telling his patients about it. And he said to me, you know, Doug, all my 20 years or whatever of practice, I never ever took anyone off insulin. Yep. And he said in the last 5 months, because he got hold of me like 5 or 6 months after the event, he said in the last 5 months, I've taken 11 patients off insulin. And he said, I didn't take them off insulin. He said they took themselves off insulin.
Yes.
I just advised them how they could change their lifestyle, you know, and give it a go. And exactly. they did it, and I had to take them off their medications. And, you know, those stories that you told were just, it was mind-blowing. So I thank you so much for being, I say often to people, thank you for being part of the solution and not part of the problem.
Yeah.
And I'm so glad that you're involved with with the SMHP, and I really look forward to where this is all going to go. I've got high hopes for it now. Thank you.
Absolutely. Me too. Thank you.
You've been listening to an episode of the Low Carb USA podcast. You can support us on Patreon at patreon.com/lowcarbusa.